We asked veterans how they were consuming cannabis, for what health conditions were they facing, and were they using cannabis to reduce any type of prescription medication. Cannabis Center of Excellence was established in 2018. We are a virtual cannabis center of excellence based out of East Boston that brings together citizens, patients, academics, healthcare providers, and researchers to drive the industry forward. I'm the president of the Cannabis Center of Excellence, and Peter is one of our scientific advisors. Now, since 2018, I've been fortunate to be the principal investigator of 8 different research studies, and one tonight that Peter and I were co-investigators on that we'll talk more about. You can now go find a great resource on the Cannabis Center of Excellence website. Thanks to Keefe Studio and Gibby's Garden for the support to make that happen. Starting my work as a researcher in 2018 in cannabis, all the studies that I've worked on have come up with a very similar theme. Consumers, patients, or veterans reporting using cannabis as an alternative to other substances. Based on 8 different research studies and the results of those studies, decided to launch a I Count Cannabis as an Alternative research study last year. For our webinar outline today, we're going to talk a little bit about the background of the opioid crisis, cannabis use for harm reduction, the data of the Cannabis as an Alternative study, and then we'll turn into an interactive discussion where we'd love to hear from you all. First, give a shout out to our webinar series partners. Big thank you to Green Lion Partners, Caroline's Cannabis, and Holistic Health Group for supporting this webinar series. And a big thank you to Talking Joints Memo, who's our media partner and great outlet for any kind of cannabis news in Massachusetts. Just to stop and acknowledge the co-investigators of the I Count Cannabis as an Alternative research study. Dr. Grinspoon, thank you for being a co-investigator. DJ Ritter and Alyssa, who are also online right now in this webinar. Vanessa Jones and Eva Rachel Tyne, who is a leading co-chair of several working groups around substance use and recovery in Massachusetts. The opioid epidemic is growing in Massachusetts and nationally. Overdose death rates are increasing year by year. COVID did not help the situation. And we're also seeing that there are racial and ethnic differences among overdose deaths and rates. We're seeing a large increase in fentanyl. In 2022, we're also seeing concerning new drugs such as xylazine and street drugs that are out there, continuing to cause overdoses. And we saw that in 5% in 2022 in Massachusetts. Males comprise most of the overdose deaths in Massachusetts, and the younger population between 25 and 44 years bearing the burden of overdose deaths. But here in Massachusetts, we are fortunate. Governor Healy took the lead in suing the big pharmaceutical giants and the Sacklers and causing the opioid epidemic. And as a result, there's millions and millions of dollars of opioid resettlement funding that's available across the United States and within Massachusetts to really address the harms that were caused by the opioid epidemic.